To look at this hospital, you perhaps wouldn't know it's just lived through a pandemic. The relative calm here belies the frenetic work that's ongoing to get things back to normal.
We've been trying to get through elective care for quite some time throughout the COVID pandemic and trying to get our pathways correct so that patients can come through safely.
This consultant at Warwick Hospital says their focus is on getting through their waiting list, but things could be about to get worse. The Health Secretary, who finally launched the elective recovery plan, admitted the 6 million waiting will increase further.
This number will continue rising before it falls. A lot of people, understandably, stayed away from the NHS during the heights of the pandemic. That number is around 10 million people. Even if half of these people come forward, this is going to place huge demand on the NHS.
The ambition is for the waiting list to start falling by March 2024. By July this year, the government wants to ensure no one waits longer than 2 years for treatment and to cut that to 1 year by March 2025. To do this, it wants the NHS to increase the amount of elective surgery it does by 30%.
I mean, a 30% increase in elective workload is going to be a real struggle to achieve without an increase in capacity somewhere or another. So we are already around about the 100% of pre-COVID activity.
The government is promising more capacity. £8 billion will pay for more surgical hubs and 34 extra diagnostic centres. But many point out that is only half the solution.
The question over and over again is the workforce there? It wasn't there before COVID. Waiting times were going up. And although there's some more staff in the system now, whether that's enough to bring about these quite big falls in the waiting list and waiting times is really unclear. And this document doesn't give us that clarity.
But talk of more staff, even more surgical hubs, is just too late for Emma. She was told she'd have to wait 2 years for surgery to treat her endometriosis. The pain was so unbearable, she resorted to borrowing thousands of pounds to go private.
I wish that I didn't feel like my hand was forced into paying so much money for something that, you know, is provided for free or meant to be free.
This is, we're told, the biggest catch-up programme in the history of the health service. The question some are asking tonight is this a big enough recovery plan to get on top of it? Emily Morgan, News at 10.